Hi, I'm Dr. Mark and welcome to VetMed TV. VetMed TV is about showing you guys behind the scenes of our vet hospitals. But it's also about giving you some tips on how to look after your pets, a little bit of vet advice, what food, what flea products to use. But it's also about getting out and about and meeting other people with their pets, seeing how they have fun with them. Today we've got Izzy in to do a keyhole spay. We're going to follow Izzy from the very moment she comes in the door with her owner and what happens in the operation and watching her go home, all within about a 3 to 4 hour period.
So we'll pop through here. Okay, so today we've got Izzy in for a laparoscopic spay. Is that right? Okay. So what I'm going to do is just go through a few questions with you first, and then we can have a chat about what today's procedure involves. Has she had anything to eat since last night?
No.
No? Okay. She on any current medication?
No.
No.
After a thorough pre-examination and medical description, Izzy's ready for the next step.
What we're going to do is give her a good check over before her anaesthetic, take some bloods, have a look, make sure all her internal liver and kidney is working really well, and then we'll know what to pre-med her with and also what anaesthetic to use. So I'm just going to give her a good check over now. Hey Iz, say hello Daddy. Yeah. Let's have a look. So just checking her colour, making sure she's nice and pink, her eyes. Great. Excellent. Alright, so 38 to 39, so 38.9, perfect. What a good girl. What we're going to do is run a few blood tests. Okay, so this is Izzy's bloods. What are we doing here is just checking her kidney and her liver function and her electrolytes as well. So these are really important. The liver and the kidney are really important to metabolise the anaesthetic drugs. So we want to make sure they're normal before we pre-med her and go ahead with the surgery. Good news is, Izzy's fine to go. Let's take her up and get her pre-medded. What a good girl you are. What a good girl. Very brave, Iz. Yes, you were. This is a pre-med. What it does is it's going to make Izzy a little bit sleepy and also give her some pain relief before she experiences any pain. You're a little bit sleepy now, eh? As you can see, she's a little bit sedated, which is good. We want them nice and relaxed before we anaesthetise them. Yeah, that's how we go. So we've just got her on a heating pad. Just once they're anaesthetised, they start losing heat straight away. So the first 15 minutes is really important, obviously to keep them warm and then warm during the rest of the surgery. So, all right. Just a tiny little cut down through the skin, so it just helps us get the catheter in a lot easier. This is her little anaesthetic. So we're just going to inject that through her catheter, just slowly, giving it a chance to work as she goes to sleep. So that goes straight down into her trachea, her little airway, and then we just hook her up to her gas. It's important we empty her bladder. It just sits right over where her uterus and her ovary sit, so we just don't want to damage that while she's under anaesthetic. So what we're doing here is continuously monitoring how deep she's under the anaesthetic, checking her eye position, has she got a blink, her jaw tone, and that means we can adjust her anaesthetic based on how deep she is. One of the other things we do is pop a little bit of lubricant in her eyes, just because so they don't dry out while she's under anaesthetic. Just a little bit there, just to help lubricate those eyes. Alright, we'll just take Izzy into the surgery ward. So I'm going to scrub, get my hands nice and clean, and then we'll go on in and start our surgery. Again, just a tiny little 5mm incision. Pop our camera in, let's see what we can see. Pop a little instrument, this helps us grab the ovary. There's her uterus, just there. There's her ovary, there's her little ligament. Isn't that just beautiful? Kidney, intestine, so we just go in and we grab between the ovary and the uterus. Okay, what we're looking for is Joe's little hook coming through. that's her ovary just attached to her abdomen, so we can cauterize it. Once it's cauterized, we just cut through it. Okay, we've got 2 little 5mm incisions that we're just going to close. So one little stitch, just be careful there. She can run around all she wants because it's not going to affect her running around. Normally a big wound, she's got to be quiet, so if a stitches come undone, all the insides can pop out. This can't happen with the surgery. Just brilliant. She's going to be so comfortable. This has been probably about 5 minutes since we turned our anaesthetic off, so she's just starting to wake up now. So it's just going to give a little manicure. Let's go! Two little spots, 2 little stitches, one there, one there. Yep. So that's all she did. You got it, hey? Good girl. So just a couple of things we've got for her. So these are just some anti-inflammatories. Tell us. Just half a day. That's all you need. Yep. And we can start it today, tonight. So just for 3 days, 3 or 4 days. That's her little desexing certificate. So you just got to take that to the council with the little pink form.
Yep, that's the one. Yep.
Yep, and just register. And we need to see the back in about 7 days just to take out the steps. Alrighty. So she'll be a little bit sleepy for the next 24 hours, and after that you'll probably have to just take a leash box and keep her fairly quiet.
No problem.
Alrighty. Hey, gorgeous. What a good girl. You had a big day today, didn't you, hey? Yes, you